Alrighty. Hi, everyone. Welcome to our Caffeinate and Advocate session, Advocacy 101. My name is Nikita Barman, and I'm an intern with the Office of Government Relations at Boston Children's Hospital. I'm joined today by Allie Doyle, an Office of Government Relations intern, Jamie Gaines, our Manager of State Government Relations, Amara Azubike, our Director of Behavioral Health Policy and Advocacy, and Shannon Moore, our Director of State Government Relations. Here's a quick agenda looking at what we will be discussing today. We'll start off with a little overview of our office and what we do, and then we'll dive into the legislative process and areas of advocacy opportunities. And then next, we'll go into discussing Boston Children's Hospital legislative priorities and how to get involved with us. Finally, we'll end our session today talking about ways you can get involved today using your voice to help us advocate for kids.
Hi, everyone. I'm going to be starting by explaining a little bit about the Office of Government Relations. You may have heard of the Office of Government Relations from previous advocacy efforts, our voter registration campaign, census campaign, or the Children's Advocacy Network. As you can see here, we are a small team, but we're actually one of the largest government relations teams in any children's hospital. You can see we have people on both the state, federal, and city levels, as well as regulatory spaces. The Office of Government Relations is part of the Children's Advocacy Network. However, the Children's Advocacy Network encompasses our team as well as all of you. Anyone who's interested in children's advocacy and can be a part of the Children's Advocacy Network by signing up through our Children's Advocacy newsletter, which Nikita will put the link for in the chat box. Some fun facts about the Office of Government Relations and the work that we do. Did you know that there are actually almost 8,000 bills filed each year in the Massachusetts legislature, and every single one of those bills has to have a hearing? And there are about 9 level 1 bills that Boston Children's Hospital prioritizes each year, about 50 level 2 and 100 level 3 bills. And we'll talk more about how we choose which bills to prioritize in a little bit. I'm going to pass it over to Nikita, who's going to explain a little bit more about the process.
I'll go a little bit into the legislative processes. So Massachusetts is a pretty old state, but the benefit is that our state and federal legislative processes actually look very similar. So on this screen before you, you'll see a visual representation of the federal process. If you've been hearing about the news and things, it might make it seem a little complicated and too convoluted to really understand. However, as you can see in this diagram, I like to think of it more as like a chutes and ladders sort of deal. There is a direct way, but there's also tons of indirect ways like the news highlights. But as you can see before you, the House and the Senate follow very similar paths in order to get a bill passed into law. A bill or an idea is introduced into each chamber, and then it goes through committee action where they debate out different amendments, things like that. And then it goes back to the floor in each chamber for a vote. The main difference between the House and the Senate here, though, is that the House has a rules committee, which sets things like time, different processes, things like that, whereas the Senate doesn't. So one of our team members, she's the manager of federal government relations, actually used to work for the U.S. House of Representatives, and called the noticeable difference almost like the Senate worked like the Wild West. But basically that's why you hear more about things like filibusters and more floor action happening in the Senate versus the House. Some other differences are that the House is much bigger than the Senate. One body might be a little bit more conservative or more liberal than the other, things like that. However, once those bills move through each chamber and goes to a floor vote, they then come together in what's called the conference committee, which is made up of members of both bodies who come together to draft one final version of the bill. That final version moves back onto the floor for each chamber. It goes through a vote and then finally moves onto the president's desk, who can either veto the bill or approve it and pass it into law. Next slide, please. And so this slide shows more of the state process. And although it looks very different than the federal process, it actually functions very similar. So the two biggest differences between the state and the federal process actually happen in step 2, which I'll highlight when we go through all of them. But to start off with, an idea is introduced. This is a great place for advocacy opportunities and to hear your voice, because this is when we develop ideas into bills. So a good way to get your idea heard is by filling out our legislative survey, which we'll talk a little bit more later on in this presentation. But at this step, it's when we're able to translate any of those ideas into bills and find sponsors for them. Those are legislators who will bring these bills to each of their chambers and introduce them. Then we move into step 2, which it works like the federal process when it goes into different committee hearings. And so the biggest difference is that in Massachusetts, Allie mentioned this earlier, is that every bill has to have a free and open hearing. That means all 8,000 bills that are introduced. This means that anyone can attend and anyone can testify. So you can testify by either submitting written testimony or present orally for 3 minutes at the hearing that each bill is heard at. And so at the difference between the state and the federal process, though, is that at the federal level, you have to be invited in order to testify. So this is a great opportunity for advocacy involvement because it allows for opportunity to really get your voice heard and have those face-to-face interactions with legislators. Because not only are you able to testify during the hearing, but there's also opportunities to hold and schedule up to 30-minute conversations with different legislators. So at the end of the committee hearing, there are 2 potential outcomes. One is that the bill is reported favorably by the committee. This means that it will progress on to the next step. And the second is what we want to avoid because it means that the bill is sent to study, which means that it will be tabled for the next 2 years. And this is because each of our legislative sessions or cycles are 2 years long. So it means that the bill will not be heard again for the entirety of that session. So we want to make sure we avoid that and make sure all of our bills are pushed through and reported favorably, which is why we need your voice, advocates and advocacy, to ensure that all of the bills are reported favorably. So this is a little plug to sign up for our CAN so you can get involved and hear more about ways you can help make sure that all of our bills do pass successfully. And then the third step is that it moves into the Ways and Means Committee. And this is perhaps the most important committee because it controls the money. So we want to make sure all of our initiatives and our bills are funded appropriately. And then it moves into step 4, which is much like the federal process where it goes back into a floor in each chamber for a vote as indicated by those double-crossed arrows. And then it moves into step 5, which again is like the federal process, made up the conference committee made up of members of both bodies who debate out and finalize one final draft of the bill. And then finally, it's sent to step 6 to the governor, much like the federal process, who can either veto it or sign the bill into law. We are now focusing on our next legislative session, so that's 2021 to 2022. And so we want to hear from you about your ideas through our legislative survey, what you think Boston Children's Hospital's priorities should be for this next upcoming year. And we'll drop a link into the survey box that'll give you more information and details, but we'll touch upon this survey in just a little bit, but just keep your eye out and mind out for different ways that you think, or different issues that you think we should be prioritizing this next year. Next slide, please. And so I just talked for a little bit and it might seem a little complicated and a little convoluted, but don't worry. We just want to reiterate that while this process can seem daunting and a little complex and a little overwhelming, the Office of Government Relations is here to help. We're here to help you navigate the process and find different ways that you can get involved to make sure that your issues are heard and represented throughout the entire political process.
So you might be wondering how the Office of Government Relations chooses their priorities each year. We think of a couple different things when we're deciding which bills to back. Number 1 is alignment with the Boston Children's Hospital mission. We want to make sure that anything that we are focusing on aligns with our values and mission. 2, child health impact. We are Children's Hospital. We want to make sure that these bills are addressing children's health issues. The financial and operational impact of the hospital is also incredibly important. We also think about internal and external feedback. So as Nikita mentioned, our legislative survey is really important. So we get that internal feedback and we hear what you all have concerns about and what you think is most important. External feedback has to do with community feedback as well as feedback from our coalition members that we work with and other partners outside of the hospital. We also think about political will. We want to make sure that any bill we're supporting has a chance of going through and being reported favorably and having a positive impact on our communities and on children. Lastly, this year we're thinking a lot about how our legislative agenda impacts racial inequities in healthcare. We want to make sure that every bill that we are focusing on and supporting is addressing the systemic inequalities in healthcare and within our hospital and our communities. I'm now going to pass it over to Jamie Gaines, who's going to talk a little bit about the legislative cycle and about some of our bills that we've worked on previously.
Awesome. Thanks, Allie. Thanks, Nikita. And thanks for everybody on the line. Just want to give a big shout out to Allie and Nikita, our two fabulous interns who have been with us and have communicated with many of you throughout the year. This is the first time we've had interns present this material. And if you think they're doing a great job, definitely feel free to drop them a note in the chat. So let's talk a little bit about the legislative cycle. And I just want to clarify that we're really talking about Massachusetts here. We'll have one slide on the federal issues, but we'll be able to direct you of where you can get more information on either Massachusetts, other states, Fed, or city in the chat. So our legislative cycle in Massachusetts runs every 2 years. So we're now at the end of the second year of our legislative cycle. Another thing to note in Massachusetts is that our legislative cycle and our election cycle are pretty much running parallel. So when the legislative cycle ends, that's when elections start, and the entire body, the House and the Senate at the state level, is up for re-election. So it is really important that we're paying attention both to the election and to the legislative cycle. And we're going to be doing a lot more on voter registration and education as the summer goes on. If that's a space that you're interested in, definitely feel free to reach out. So our legislative priorities, as Allie mentioned, are determined by the Children's Advocacy Rounds and Education Tour that we used to do at the hospital. And seeing the names of our attendees, I know that many of you have participated in these. But because of COVID, we're not able to go through the hospital and meet and have face-to-face conversations with you. So this year, our department has developed a legislative survey. So Allie and Nikita are going to drop the link. And what we'd love you to do is take the time to fill this out and send it along to your colleagues and families across the hospital that are interested in making sure their voice is heard in the legislative process. This will ask you about COVID stories that you'd like to share, successes from the year, legislation that you've worked on with us, other legislation that you'd like to see us work on, legislation related to racism and making sure that we're addressing it both institutionally and at the higher levels, and all other kinds of things. So this is the best opportunity to make sure that your voice is heard in the upcoming legislative cycle. At the federal level, the Children's Hospital Association, of which the CEO of Children's, Sandy Fenwick, sits on the head of, they're really setting the agenda at the federal level. And we'll talk about that in a little bit and how you can get involved. But just know that there are different processes for the state and for the feds. And lastly, COVID has really changed the landscape, both of the policies that we're working on, how we work on, and what our advocacy work is looking like. So there will be more virtual meetings with legislators, there will be more virtual webinars, but this does not mean that our advocacy stops. It just means that it's going to take a little time to reshape the work that we do. And we're really excited to have you all as partners in that work. So next slide. So these are the federal priorities, and I'll just say again that I am the manager of state government relations, so I'm standing in for Amy DeLong, who is our manager of federal government relations, and you'll see that her contact information is right on the bottom. These are a couple of the things, though, that we're working on at the federal level. So obviously, COVID-19 is a massive part of what Amy spends most of her time on, and children's hospitals and pediatric providers should be able to get equitable relief to adult providers. We want to make sure that we're focusing on research related to COVID-19 and other related diseases. And we want to make sure that our independent practices, our independent physicians are able to get the relief that they need as well. We're also working, as always, on strengthening Medicaid and CHIP. We're working on strengthening the pediatric workforce, mostly through CHGME, which is the Children's Hospital Graduate Medical Education Program. And we're advancing pediatric research through the implementation of the National Pediatric Research Network Act. If you have questions on any of these or you're really interested in how you can get involved at the federal level, again, drop Amy a line. Next slide. So now we're going to talk a little bit about the state stuff. So any of you that have seen our legislative agenda or that clicked on the link in the chat, you're going to see that we typically break our legislative agenda up into 3 buckets. And those 3 buckets are represented by each of the members of the state team. And we're really lucky to have new members of the state team on with us today. So not only will we get to hear a little bit about their work, but you'll get to get more familiar with their work styles. So in the public health and prevention space, which is what I primarily focus on, we've been working on 3 main things. The SNAP gap, which is the number of people on Mass Health and the lower number of people on SNAP. We know that these numbers are often misleading because the programs have very similar eligibilities but have two unique application processes. This can be incredibly daunting, especially for immigrant families and homeless families that often have trouble tracking down documents, going in person, or just sitting there and having the time to fill out these often incredibly long applications. So we're working on creating a common application or an easier application so that people can apply for these similar services at the same time. And we were really excited to get $1 million in the last state budget to start working on this. This is something that is a long-term campaign. I know this is something we'll be continuing to work on. So if you're interested in food access or food inequality, make sure that you're putting that down in the survey. The next thing that we worked on, and big shouts to our emergency department and our trauma teams that really came out, also our injury prevention team that came out to support the Hands-Free Driving Act, which was an act to prevent distracted driving. Most people know this is the Hands-Free Driving Bill. And this was passed into law. So I saw a couple members from our emergency department, our trauma team, and our injury prevention on here. It was their testimony and their tireless hard work and their meeting with elected officials that helped get this bill passed. And we were so excited because we know that kids are harmed by people who are distracted driving. We know that teens really struggle with making sure they're paying attention to the roads. And this is something that is only going to get worse as technology advances. The last bill that we spent a lot of time on was Stop the Bleed. So this would require trauma kits in public buildings. And while this bill was sent to study, we had really good conversations with elected officials about this bill. In the regulatory space and also in the legislative space, one thing that really came to a head this cycle was the tobacco and e-cigarettes conversation. So it was really wonderful to work with pulmonology, cardiology, and the ASAP program to make sure that we had a flavor ban in Massachusetts, which is one of the most comprehensive flavor bans in the country. And it is just a real signifier that Boston Children's will continue to support public health and prevention when it comes to making sure our young folks are safe. So with that, I am going to turn it over, I believe, to Shannon, but if not, Amara, one of them will guide you through the next part of our legislative cycle.
Thank you, Jamie. I am Amara Azubike, the Director of Behavioral Health Policy. In my role, I advocate for increased access to quality and timely behavioral health services for children and adolescents across the state. And my position as a behavioral health policy specialist in a government relations department is actually quite unique and really demonstrates the commitment of Children's Hospital to expand access to pediatric behavioral health care. And so much of the advocacy success that the hospital has had is largely due to the strength of our coalitions. I'm part of the leadership team of the Children's Mental Health Campaign. It's a coalition led by the Boston Children's Hospital, MSPCC, the Parent Professional Advocacy League, Healthcare for All, and Health Law Advocates, and also Massachusetts Association for Mental Health. And so together with the campaign, we came up with a number of children's behavioral health legislative priorities. I've highlighted two here. First is a bill on mental health parity. Mental health parity recognizes that insurance coverage for mental health conditions and substance use disorders should be the same as coverage for physical health problems. And despite existing parity laws, true parity has yet to be achieved. We know that many children need access to behavioral health care services and they aren't able to access them. So this bill seeks to close loopholes, increase transparency, and also provide consumers with tools to understand parity and to challenge violations. And so this was recently included in the Senate ABC bill. The next bill was on ghost networks, which refers to out-of-date and inaccurate provider directories. This bill requires insurers to meet reporting and transparency standards to improve the accuracy of provider directories, which is critically important to accessing timely and appropriate behavioral health care. These provisions, thankfully, were advocated for and was included in the Children's Health and Wellness Bill, which passed in late 2019. And in terms of regulatory advocacy, much of my role centers around advocating for increased access, particularly in the inpatient space, but across the care continuum, really working to increase access and also work on workforce development in that space. And as Jamie and others touched on, COVID-19 has had a major impact on our advocacy right now. Various state agencies and the executive branch have announced a number of policy changes to mitigate the spread of COVID-19. And some of these policies definitely impact behavioral health providers and patients. Rather than touch on everything, I just listed two main focus areas of recent, which is around telebehavioral health. I think Shannon will speak more to this, but we want to ensure, we're working to ensure that the recent policy changes that have enabled increased access to telehealth remain in place. And my focus is particularly in the behavioral health space. Also, folks are gearing up to planning for a potential in-person return to school. I'm working with a campaign and others and advocating for appropriate behavioral health supports in school, what that should look like beyond, the very necessary PPE conversation and safety concerns. What are we thinking about in the behavioral health space? What do parents and students and educators need? And that's it for me. I'll pass it on to Shannon.
All right. Hi, everybody. I am Shannon Moore. I am the Director of State Government Relations at Children's Hospital. That means my job is to work on legislation and policy at the state level, working with the legislature, the governor's office, and related state agencies. I worked for the state for 13 years for the House and the Senate and at the agency level before I joined this team in March. So while I wasn't here when the legislative agenda was crafted on these topics, I think you'll get a good idea of the type of things we work on in this office. So telemedicine was the #1 priority on the state agenda. And for better or for worse, the COVID-19 crisis has brought telemedicine to the forefront of care, both statewide and nationwide. And this has helped us ensure that kids are able to access care during the crisis, including behavioral health and mental health services, and also keep them out of the hospital where they may be exposed to COVID or other infections. This bill was originally filed by Rep. Golden and Senator Lewis and was seeking to kind of open the doors to telehealth by establishing a broad definition of telemedicine that would cover both interactive and so-called store-it-forward technologies, and also ensure that services delivered by telemedicine were covered by the patient's insurer at the same level as in-person visits. In response to the COVID crisis, the bill was partially implemented via executive order, and I will talk a little bit more about how an executive order works in a minute. The next bill we were working on was an act relative to newborn enrollment in mass health. This bill is seeking to resolve an issue involving mass health coverage. Healthcare providers were encountering difficulties with a mass health policy that automatically assigned a newborn upon their birth to a health plan based on their mother's managed care enrollment. This was resulting in confusion or barriers to care because the plan that was assigned to the baby often didn't include the baby's pediatrician in the plan. So as is noted on this slide, this was resolved by Mass Health without legislation. And what is happening now is there's a grace period between when the baby is born and when the parent has to select a plan so that the child is not without access to their pediatrician during those critical early days of their life. The next bill, an act relative to children with medical complexity, directs the Health Policy Commission to conduct an analysis of children with medical complexity, including the utilization of services among this population, other data including the costs of equipment and prescription drugs that these kids need, and data on the demographics of this population in order to identify where gaps in programs and services are for complex kids. This legislation was actually included as part of a larger bill relative to children's health and was actually signed by the governor in November of last year. Other topics that our state office watches includes regulatory changes relative to insurance coverage for kids and other barriers to healthcare accessibility for kids. We also do a lot of monitoring of regulations that relate to family homelessness and prevention and housing safety as a quality, as a social determinant of health for kids and families. So on the next slide, since I mentioned that telehealth is currently being implemented through emergency order, I thought I would touch upon the COVID state of emergency in Massachusetts and a bunch of things you probably hear in the news fairly frequently. In March, the governor declared the state of emergency. A state of emergency declaration gives the governor special powers to react quickly to a crisis. Usually this is responding to a hurricane up here, but you know, this is also the current pandemic. This enables the governor to make temporary changes to the state law without the approval of the legislature, and also gives the governor the ability to request federal funding and equipment to respond to a crisis. Then an executive order is the vehicle through which the temporary amendments to state law are made. These could be widespread policy changes. They could be very specific policy changes. Immediately after declaring a state of emergency, the governor issued a series of executive orders that included the closure of non-essential businesses and, for instance, the suspension of elective procedures at the hospital. Executive orders that enable telehealth had also required that health insurance, including both Mass Health and the commercial plans, reimburse for telehealth services at the same rate they would pay for in-person services throughout the duration of the emergency. So we also get a lot of questions about what happens after the emergency is revoked. So most of the emergency orders will expire when the state of emergency is revoked. So when the governor declares the emergency to be over, these executive orders will cease to exist. So that is also why we will be pursuing legislation on things such as telehealth to kind of maintain these policies after the emergency, where we think that they would be good policies to have in place more permanently through a legislative solution. And with that, I will turn it back over to Nikita and Ali.
So I'm now going to go into a little bit about the process of advocating with the Office of Government Relations at Boston Children's Hospital. So some of the basics: Boston Children's Hospital is a 501c3 nonprofit organization, which means we are not able to engage in any type of campaigning or endorse any candidates. We are not allowed to give any money or donations to a campaign. However, we can work on nonpartisan activities. This means we can do voter registration drives, voter education, we could hold debates, we can focus on issues. We can't focus on candidates. This can be a little confusing, so if you have any questions, feel free to put them in the chat box. But we just have to remember issues, not candidates. This is also an important slide that kind of breaks down the ways in which you can advocate as an individual. So the first slide, or the first bucket, is the Boston Children's Hospital employee bucket. This means that you want to take part in advocacy with the Office of Government Relations. You represent the institution's opinion and stance on something. You've talked to the Office of Government Relations about this, and you want to go talk to the legislature about why they should pay attention and why this is an important issue for you. The second bucket, let's say you're a social worker, Boston Children's Hospital hasn't taken a position on an issue that you believe in, but the National Association of Social Workers has. So what you would do is you would work with the National Association of Social Workers, NASW, on that issue. You could go to the legislature and talk about yourself as a social worker and as a member of NASW and why you think that they should pay attention to this issue and why it's important to you. You would not talk about your role at Boston Children's Hospital. You would talk about your role as a social worker and a member of NASW. The last bucket is the private citizen bucket. So you're living in a neighborhood and something's going on and you want to talk to a local representative about this issue. You're not going to go in as a Boston Children's Hospital employee. You're not going to go in as a member of NASW, but you're just going to go in as a resident of the neighborhood and talk about why this issue is important and why they should listen to you. But again, not as an NASW member or Boston Children's Hospital employee. I'm now going to kick it over to Nikita, who's going to talk a little bit about some voter registration.
Hi everyone, so the next couple of slides will be on 2 ways that you can get involved today with our advocacy work. So the first one is by joining our #BCHVotes campaign. This is our campaign to raise awareness on how to register to vote and the importance of voting. So voting is a way to ensure that everyone has a say in the political system. And so by registering to vote and casting your vote, it's your chance to stand up for issues you care about, including children's health. And so there are two main updates to voter registration this year, because one, as of January 2020, Massachusetts actually started automatic voter registration. So that means everyone who has gone through transactions with, for example, the RMV, will automatically be registered to vote. This sort of eases the process and makes sure that registering to vote isn't another barrier to voting. I've actually dropped a link in the chat box where you can check to see if you are registered to vote in the state of Massachusetts. And the second update is that during COVID, a law was passed to allow all registered voters to be eligible to vote by mail. And this means that you don't have to report to any polling booth or anything, but you can cast a ballot by mail. However, with voting by mail, there are certain deadlines that you need to keep in mind, which I can highlight on the next screen. Allie. So if you are voting by mail, you want to ensure that you submit your application to vote by mail. So that's your application to ensure you receive your ballot at least 4 business days before each election. So 2 deadlines to keep in mind are for the Massachusetts primary, which is going to be on September 1st. You want to make sure you submit your application by August 28th. And that will make sure that you receive the ballot in time to be able to submit it before or by Election Day. And then the Massachusetts general election is on November 3rd. So you want to make sure you submit your application to receive your ballot by October 28th. And again, we are happy to share these slides if you want to keep these dates, if you want to see these dates for future reference. But we do want to iterate that the Office of Government Relations wants to be a source of information. We have everything from one-pagers to social media campaigns and QR codes. So we're happy to help out and partner with any department in any way to sort of advocate for voter registration and host voter registration drives. So if you are interested, definitely reach out to us at can@childrens.harvard.edu. We'll drop that email in the chat box later. If you are interested in partnering with us to sort of advocate for voter registration. And if you are in the hospital, keep your eye out for different social media activity that we have going on. Look out on those TV screens and things because we will be trying to raise awareness for voting and voter registration. Also keep an eye out for an additional Caffeinate and Advocate session that'll be hosted in October, focused solely on voter registration and voting. Next slide, please. And the second way you can get involved is by participating in that legislative survey we've been hinting at throughout this entire presentation. So we want your voice to be heard in determining our Boston Children's Hospital's 2021 to 2022 legislative agenda. And we know that it is our employees, our network, our community, our patient families who help make us effective advocates for children across the state by bringing issues that they see every day to our attention and that we're able to translate those issues into bills and policies. We would love to hear about your policy interests for both short-term and long-term systemic change, like Allie mentioned earlier in this presentation. Our past legislative cycle for 2019 to 2020, we were able to focus on issues related to healthcare access, social determinants of health, and behavioral health. So this year, we want to hear more about those issues and also some broader questions about policy interests and anything that you might, or anything that you're interested in seeing brought to sort of a policy light. And so with your help, we can ensure that Boston Children succeeds in our mission to continue advocating for children across the Commonwealth. And so we ask that you can submit the survey by Friday, July 30th. And if you have any questions, again, don't hesitate to reach out to us at can@childrens.harvard.edu. And again, I'll drop all those links in the chat box right after this. And I'll hand it back over to Allie.
So now we're going to focus on some questions. Please feel free to continue to put questions in the question and answer box. So we're going to address the ones that were submitted during the registration process first, and then we'll get to any ones that are there. So the first question is for Jamie. Hi, Jamie. How will the ongoing pandemic and need for social distancing impact advocacy efforts?
This is a great question. I have 2 answers. The first answer is we're still working it out. because COVID is still relatively new, we're really working on adjusting what it means to advocate during a global pandemic. So the first thing that we did is we took all of our events online. So events like these have been going on throughout the time. We did one on telemedicine, we did one on behavioral health, we did one on tobacco and vaping. You can find all of those on our YouTube page. They're all recorded so that our clinical folks can come no matter when their shift is. We will be doing some some virtual meetings with Shannon and Amara as the new legislative cycle kicks off. And those will be virtual meetings that you can potentially do with an elected official. We're doing our legislative survey so that folks can participate and have their voice heard. And the last thing is voter registration and education. We're moving this effort entirely online, and more will be coming out, but you could check out the video screens and all the other things that Nikita mentioned. The last thing I'll say on this is, oh yes, and the census. We're also paying attention to the census and to make sure that we have a fair and accurate and complete count of all of Massachusetts residents. The last thing I'll say is that if there are ways that your department, that your families, that your staff, or that you want to get involved that we haven't mentioned, definitely reach out. We're excited to be working in this new space, but we know we don't have all the ideas. So if there's any way that you want to get involved that we haven't laid out, please reach out to us and we will find a way to make sure to connect you to the advocacy that you are most interested in.
Thanks so much, Jamie. The next question is for Shannon. Will the recent increase in reliance on teleconferencing platforms such as Zoom create new opportunities for federal advocacy?
Sure. I think the answer to this one, if I'm understanding the question correctly, is very similar to Jamie's, where we've always relied on email, phone calls. Obviously right now we can't do face-to-face meetings with folks. So we are exploring how we can use Zoom and other platforms to engage legislators and their staff. In terms of federal advocacy, the best person to speak to about that would be Amy DeLong on our team. We can put Amy's contact information in the chat. She's really the best person to talk about federal issues with, but I am always available if you want to email me to talk about issues going on at the state level.
Great, thanks so much, Shannon. The next question is for Amara. I am interested in behavioral health issues, especially with concerns the upcoming school year. How can I get involved?
That's a great question, and it's something that so many people are concerned about, and there are various ways you can get involved, but I would say after this presentation, Allie is going to send out a link to a sign-up list if you want to join some of the advocacy that we're doing at the Government Relations Office if it's pertaining to behavioral health. I would say that as the budget is being debated, there'll be opportunity to advocate for protecting key programs aimed at school-based behavioral health. DESE, the Department of Elementary and Secondary Education, released guidance for schools about how they should be preparing for this work. So if you're interested in resources and information about what the schools are seeing and doing in this space, we could also share that.
Great, thank you so much, Amara. The next question is for Jamie. How can adolescents get more involved in advocacy?
Love this question because I think adolescents are our secret weapon when it comes to advocacy because they're so close to being able to vote and they have so much energy around the topic, but they don't always know the best way to direct it. So a great way to direct 16 and 17-year-olds is having them pre-register to vote. 16 and 17-year-olds in Massachusetts can get all ready to vote starting today so that when they turn 18, they're automatically set up and good to go. This helps them feel engaged in the process and like they're able to participate even if they can't vote yet. Another great way to get adolescents to participate is to make sure that they are asking those 3 feet around them, so siblings, family members, folks inside and outside of the home, what their voter registration plan is. So have they registered to vote? Are they voting by mail? If they're voting in person, do they know where their polling location is? Do they know what time they're voting? We know that when people have voter plans, they're much more likely to actually go and vote. So good thing for an adolescent to do is get folks thinking about voter registration plans. There are lots of other ways to get involved. We're currently chatting with folks over at the GEMS Clinic about having an Ask the Advocate Zoom sessions where kids can come in and ask their questions. We're really here though to make sure that they can get involved in any way. They can testify at the State House, they can meet with their elected officials, they can send emails, they can do calls. Anything that an adult can do, adolescent can do, except for actually going to the polls and voting. So Allie, I'm actually going to tee you up for the next question because we got a question around the census, and Allie has been leading our census work. So Allie, can you talk a little bit about what the 2020 census work has looked like at Boston Children's Hospital?
Yes, so before COVID, we had some really big plans about being in person at the hospital, doing tabling, events around the census, and really just trying to get that census information out. Obviously, after COVID, we had to turn everything over to virtual. What we've done so far is we have TV screens up throughout the hospital and all the satellite sites with not voter registration, but we also will have that for voter registration, but with census information. We are doing social media pushes on Instagram, Twitter, Facebook about the census with videos from different stakeholders within the hospital who are interested in census work, including nurses and doctors. We are also in the process of we've had a couple op-eds already published about the importance of the census. We're trying to get one published right now, specifically in Spanish. All of our materials that we've developed can be shared virtually, and we have them in English, Spanish, simplified Mandarin, and Arabic. So if you're interested in obtaining any of those materials, please just let us know and we can send those all to you. We are going to continue to try to do more social media pushes. Anytime that there is an in-person event, we would love to provide you with more materials to put in any type of physical bags that you might be giving out. I know Martha Elliott is working on doing a helmet drive and giving out helmets. We're going to try to put some stuff in there. So anything like that, we would love to support you with. If you have any other questions around the census work, please let us know. If you have questions about language to use in ensuring that the census is a safe and very important way to get involved in your community, please let us know. Again, we can give you some more information on that. The next question I'm going to toss over to Shannon. Is there a way that we can support patients and families during this time of housing security?
Sure. I know housing is at the forefront of a lot of folks' minds, especially during this crisis. We are currently, and we know that housing is such an issue of health equity and a social determinant of health. I would love for everyone that's filling out the survey to include housing as an issue if that is something that they want to work on and with us. We just also got word that the governor has extended the current evictions and foreclosures moratorium through mid-October. And we know we're getting a lot of questions about that current policy, so that's great news for folks. I think earlier in the presentation, we had talked about individual advocacy as an opportunity for you to contact your legislature while the hospital kind of works out what our advocacy is going to be, our advocacy work is going to be on this. We do recognize in the GR office that this is something that we would like to work on as well. We're just kind of still working on what the next action steps are for folks at the hospital. So more to come on that. I'm sure we'll be emailing action steps through the CAN at some point. So please keep a lookout for those communications from our office. And as always, feel free to reach out to us if there's something we can help you communicate with your legislator on.
Great, thank you so much, Shannon. This last question is, or not the last question, we have a few more from the chat box, but this one here is for Jamie. Will there be a focus on children and adolescents of color? I'm assuming that this is in reference to our legislative agenda and the work that we're going to be doing in the future.
The answer is 100% yes. So if those of you that subscribe to the CAN might have seen that we put out a statement regarding racial equity last month, and it was really a commitment that we are going to be doing more for adolescents and children of color and our communities of color in our upcoming legislative cycle. That being said, in the survey, and I know we keep talking about the survey, but it is the most important way to have your voice heard. In the survey, there is a question about racism as a public health issue and a question about health equity. So if there are specific bills that you're interested in having us work on, whether it's the education gap or it's housing insecurity or whatever it could be, make sure that you're noting it in the survey so that we can get a complete picture of what folks are most interested in. There's a lot of issues that are impacting children and adolescents of color. There's only so many that we as a hospital are going to be able to make meaningful strides on. So if you have a policy that you're really interested in that you want us to work on, please write it in the survey so that we can pay attention to it. If we do not choose the issue that you are most interested in for our legislative survey, no worries. We'll make sure to connect you to the advocates that are working on those issues so that you can continue to work on them in your private citizen hat, as Allie laid out before.
Great, and a question that came in is for Amara. What types of interventions and supports are you supporting for behavioral health in the context of returning to school? And does this change depending on the model the school district is using, hybrid, remote, in person?
Can you say that again? I'm sorry, Allie.
No problem. So what types of interventions and supports are you supporting for behavioral health in the context of returning to school? And how does this change depending on the model the school district is using? Hybrid model, remote model, in-person model, etc.
That is a great question, and one that is still being developed as this hybrid model, remote model, and in-person model is very new to all school districts. I would say that a lot of the supports that we've been advocating through the campaign is in large part due to the experience that we have as a hospital through our Boston Children's Hospital Neighborhood Partnerships Program, where we partner with Boston Public Schools and providing behavioral health services. And through that program, I can provide more information after this presentation, but really thinking about making sure that the staffing ratios in schools are where they need to be of the key behavioral health providers. So that's social workers, nurses, and other folks on site that are providing this care, making sure that they have there's enough of them in our schools, advocating for leveraging partnerships with the local school districts so that they are able to provide the supports that they need. And then I would say another key aspect would be to figure out how we could somehow leverage telebehavioral health in the school setting. But these tiered supports that we've been working on in the school is something that is ongoing and is continuing to be developed.
Great, thank you so much. If there are any other questions, please feel free to put them in the question and answer or the chat box. If not, we'll start our wrap up. Right. So here are some stay in touch emails. You can always email the CAN. The CAN is great. Jamie checks it every day. We're always able to talk through the CAN. If you want to email specifically Amara, Shannon, or Jamie, their emails are below. Amy's email, our federal manager, is in the chat box as well. If you have any questions, please let us know. And in our follow-up email, you'll be receiving everyone's contact information, all of the links that we've put through today, and anything else.
All right, well, I just want to thank Allie and Nikita for doing such a great job. Are there any more, just now that I'm worried I'm screwing it up, are there any other slides to cover? Okay, great. So with that, I want to thank Amara, Shannon, Nikita, and Allie for another excellent Caffeinate and Advocate. Stay tuned for our voter registration education and potentially something in the month of August. Connect with us through the CAN and through email. We're always around. Thank you so much and have a great rest of your day.